Hello everyone, I'm sorry we are just now getting started. We've been having some technical difficulties getting the system going. It is new to me. This is my first webinar. My name is Jenny Lewis. I am the Governmental Affairs Associate and Certification Compliance Liaison here in the CCAP office. So I'd like to welcome you all to the Making Pot Pay, Unpacking Proposition 64, which legalized the recreational use of marijuana. So we're going to go ahead and get started. It is an hour and a half. So if you have any questions, we're gonna take questions here and there throughout the presentation. So if you have questions, go ahead, type those in, and we'll be answering those at certain stopping points. So let's see.
You're on this. You have to have to be able to move those.
Okay. So like I said, it is new. So we're gonna try this now. Thank you, Larry.
You're welcome.
So like I said, my name is Jenny Lewis. I'm the Governmental Affairs Associate and Certification Compliance Liaison here in the office. So Prop 64, what is it? A lot of people don't know exactly what it is, or there's a breakdown on it, and there's a lot of information contained in the proposition that was passed back on November 8th, legalizing the recreational use of marijuana here in the state. So what Prop 64 allows individuals to do is to possess, transport, or give away to individuals over the age of 21 to use marijuana for recreational purposes. You can cultivate up to 6 plants per residence and possess the marijuana produced, but you can only have 3 plants flowering at any given time, and local governments still retain the right to prohibit outdoor cultivation. That does not apply to indoor at this current time. Medical marijuana users keep their rights under Prop 215 and are exempt from the new state sales tax, so they don't have to pay the sales tax breakdown that I'm going to go over later on in the webinar. Retail sales of marijuana for recreational use to begin starting January 1st, 2018, which is when legalized marijuana will be available for sale legally in the state of California. So what does Prop 64 not cover? What can you not do? You cannot consume marijuana in any public place. It is a $100 fine per infraction until on-site licensed consumption locations are permitted. Possess, smoke, or vape marijuana in any non-smoking area or within 1,000 feet of a school, daycare, or youth center. It's a $250 fine per infraction. The use of marijuana or an open container while driving or riding as a passenger in a vehicle, boat, or an airplane. It's a $250 fine per infraction on that. Manufacture concentrated cannabis with a volatile solvent. Minors under the age of 21 may not possess, use, transport, or cultivate marijuana. It is a $100 fine over the age of 18, and those under 18 are subject to drug counseling and or community service. Possession of more than 1 ounce is still considered a federal offense, and it is a $500 fine and or 6 months in jail. So who is not protected under Prop 64? Owners of rental properties may forbid the possession or use of marijuana on the property that is currently being rented and is subject to normal tenant laws for renters. Employers may prohibit the use of marijuana by their employees. Federal employees and members of the armed forces may still not use or be found to have marijuana in a drug test. So what kind of recourse do employers have for their employees? Employers may deny employment based on an initial positive drug test. Employees with a positive test may also be terminated under the current law. Employers are not required to terminate but may exercise this right. Prop 64 did not change this law in California, and marijuana is still considered a Schedule I drug under the federal guidelines. So how do the credentialing organizations view a positive test if you are a current registered or certified counselor? So that's any of the 3 organizations. That's CCAP, CADI, and CADAP. So how do they view this? Well, as part of the coalition agreement, all of the certifying organizations have agreed to a standard code of ethics and a code of conduct, along with a standard uniform disciplinary guidelines. The Code of Ethics states under Principle 2, Section F, engaging in the practice of addiction counseling, being present where addiction treatment services are administered, failing to disclose relapse and recovery, or attending program services or activities if impaired by, intoxicated by, or under the influence of illegal drugs, legally prescribed drugs, or alcohol. The uniform sanctions in regards to the specific section state: the first offense is 6 months suspension. If in recovery, personal letter describing treatment and or relapse prevention efforts are required to be submitted prior to the end of that 6 months. The second offense is 1 year suspension. If in recovery, personal letter describing treatment and or relapse prevention efforts, letter from addiction treatment program documenting successful completion of a treatment program and plan for continuing care, and proof of completion of 20 continuing educational units. Any subsequent offense after the second one is revocation, permit denial of licensure, certification, or registration, and all of your fees will be forfeited under this sanction. So what are the immediate legal changes? Sentencing changes for adults 21 and over. Green is legalized, yellow is a misdemeanor, and red is a felony. So the new prop changed only here in California. It does not cover outside the state. Other states do have their own. They have their own requirements for what is legal and what is not legal. So some of them changed and some of them didn't. It's possession up to an ounce for, up to an ounce is legal for 21 and over. Anybody under the age of 21, it's $100 fine. If you're under the age of 18, it is subject to drug and alcohol counseling and or community service. It's current time. Cannot sell to minors. It is a felony. It is 3 to 7 years in prison, and we can make this chart available to any individual who does want this later. So if you have any questions, we're going to go ahead and enable the Q&A at this current time. So if you have questions, you can go ahead and type those in to the section. And so if you have any questions, you can go ahead and type that into the box on the right-hand side of your screen. So the first question is from Alicia. Will you be emailing this information out? At this current time, I'm not exactly sure how this information will be made available. I do know that we have kind of a pared down chart of the information on the website. It is at ccap.us and it's under membership FAQ. At the very top, there is a Making Pot Pay presentation that Sherry and I did at the Substance Use Disorder Statewide Conference down in Anaheim back in August. So you can see that information there. And then I'm not 100% sure if we're going to be emailing out this particular presentation or not at this current time, but I can definitely find out. And I can make that announcement on the Facebook Live that I do on Thursdays at 3 as well. The second question comes from Terry Galvin. Did the penalty for selling to a minor increase? No, that actually stayed the same across the board. It is still a felony for 3 to 7 years is the penalty for, it's a federal offense. The next question is from Diana. We're actually going to get to that later on, so I'm going to actually hold off on answering your question about how they're going to measure intoxication. So a lot of the questions we're getting, that I'm getting is if we're going to make the PowerPoint available. I'm not 100% sure on if we are going to. If you do watch the Facebook Live through our CCAP statewide, I will follow up and make that announcement at that time. Teresa Anderson, you asked, so a certified counselor cannot use marijuana at all. This is correct. Under the Code of Ethics and these Uniform Disciplinary Sanction Guideline, you can be terminated by an employer. It is under the Code of Ethics. If you do have a positive drug test for the first, second, and third offenses, you can be terminated. Okay, so Sherry Daly, our legislative affairs director, she just popped in and she said that all of this information will be made available. It will be going out via an email link, so you can check on that. So it will be made available after this presentation. John, you had a question about the expected revenue for the state. I'm going to hold off on that because I will be going over that here in one of the next couple of sections. The last question that I have so far, does legalization also take effect in 2017? Mark, yes, it does. It actually took effect immediately under the new proposition starting November 9th, as soon as it was legalized for the recreational use of marijuana. It took effect immediately. And Sherry, what if a counselor smokes on the weekend? It doesn't matter. It's found to be found. If it's found in your system, an employer can terminate you. They don't have to exercise that right, but they can terminate you. It is still a violation of your code of ethics and your code of conduct. Alicia, you're very welcome. So I'm going to go ahead and we're going to move on to the next section. And if you have any more questions, we will take those at that time. So there were 3 other states that started legalizing all the way back to 2011, Colorado, Oregon, and Washington. And all of these states have started seeing different things happen that is pretty uniform across the board. So I'm going to go over a few of those items in regards to what's been happening in those states as well. So the first state up is Colorado, which has had the legalization the longest. Among individuals between the ages of 18 and 25 years old, marijuana usage increased from 21% in 2006 to 31% in 2014 as part of a study that they did. Among those 26 and older, marijuana usage has increased from 5% to 12%. 33% of marijuana users who have reported marijuana use in the past 30 days have used daily. And marijuana-related arrests have decreased by 46% between 2012 and 2014, while possession arrests were cut in half and sales arrests have decreased by 24%. In Colorado, they have a system called Driving Under the Influence of Drugs. It was a study that they did that they reported out on. It's actually a really big manual. It's about 200 pages, and there is a citing in here later, which you can see. In 2014, when retail marijuana stores began operating, there was a 32% increase in marijuana-related traffic deaths in just 1 year. That was in one of the first couple of years that they actually started measuring individuals with marijuana in their system. Colorado marijuana-related traffic deaths increased 92% from 2010 to 2014. During the same time periods, all traffic deaths only increased 8% respectively. In 2009, Colorado marijuana-related traffic deaths involving operators testing positive for marijuana represented 10% of all traffic fatalities. By 2014, that number nearly doubled to 19.26%. The Colorado State Patrol DUID program started in 2014, indicated 77% of the 874 driving under the influence of drugs involved marijuana, and 41% of all 874 DUIDs involved marijuana only. So this is a chart that we did pull from the link right there. If you guys wanted to check it out, you're more than welcome to. Since the commercialization that happened in 2009, all the way to legalization that happened in 2013. And there's a lot more information contained in this manual on this program, but these are some of the trends that we're seeing. This is every state that we've seen this in. So coming up from Oregon, our neighbors to the north, approximately half or 51% of Oregon adults had seen marijuana product or store advertising in the community in the past month. Less than 1/3 or 29% had seen information about health risks of using marijuana. More than half of adults knew that 21 years or older was the legal age to use marijuana in Oregon, and more than half, or 59%, knew that it was still illegal to use marijuana in public spaces. However, nearly 2/3 said they didn't know when it was legal to drive after using marijuana. 3 in 4, or 75% of adults, knew that driving under the influence of marijuana increases the risk of a traffic crash, and half, 54%, knew that users start young face greater health risks. Marijuana-related calls to the Oregon Poison Control Center were stable from 2013 to mid-2015 and increased in the second half of 2015. From 2013 to 2015, calls for persons under the age of 13 increased. Marijuana-related arrests decreased from 2012 to 2015. And this is what we're seeing in Oregon here. The citing is right there to the left of that information right there, where you can see where the measure passed and what we're seeing as far as calls amongst poison control centers here. An overview of the youth of the current marijuana users in the state of Oregon cited that use among Oregon 8th and 11th graders is similar to national estimates. From 2012 to 2015, nearly 1 in 10 8th graders and approximately 1 in 5 11th graders report current marijuana use each year. In 2015, 9% of Oregon 8th graders and 19% of Oregon 11th graders report current marijuana use. Amongst 8th grade marijuana users, approximately 2 in 5, or 41%, reported they used between 1 and 2 days in the past month. 1/3 reported they used on 10 or more days in the past month. And among 11th grade marijuana users, approximately 1/3 or 34% reported that they used between 1 and 2 days in the past month, and 2 in 5 reported they used on 10 or more days in the past month. For the adult trends of what we're seeing in the increase amongst users of marijuana at the recreational level, 9% of all Oregon adults agree that they use marijuana more often now that it has been legalized in Oregon. A higher proportion of younger adults, ages 18 to 34, reported using more marijuana after legalization compared to adults 35 years and older, 15% versus 6%. Approximately half, or 55%, of adults agreed that more underage people will be trying marijuana now that it has been legalized in Oregon. Belief about increased underage use was higher among people that had never personally used marijuana. 72% of adults that never used marijuana agreed with this statement, compared to 46% amongst those that had ever used marijuana. Driving under the influence in Oregon, approximately 1 in 5, or 19%, current marijuana users reported driving within 3 hours of use in the past year. Frequent marijuana users, 20+ days of the last 30, were more likely than less frequent users to have driven within 3 hours of using marijuana. Approximately 3 of 4 adults agreed that driving under the influence of marijuana increases the chance of a traffic crash. And this is one of the charts that we're seeing here amongst those who reported information back. This is what we're seeing here amongst the traffic crashes here. Now, Washington is different. They did actually set a minimum for under the influence, and we'll go over that here in just a minute. Recreational marijuana consumers may legally buy up to 2,529 grams of marijuana per transaction, which includes usable, concentrate, and infused product. In July 2015, 1,164 licenses were issued, 533 producer, 460 processor, 171 retailer licenses representing 735 individual businesses. 59,394 pounds were produced during 1 year of recreational commercialization. 68% of the marijuana infused products in the state fall within the baked goods or desserts category. 90% of public safety violations against recreational licenses deal with minors. The average potency of marijuana flower for one Seattle-based retailer during the month of July 2015 was 21.24%. For marijuana concentrates, the average potency was 72.76%. The overall youth snapshot here in Washington. During 2013-2014, 48% of statewide students' expulsions and 42% of suspensions directly involved marijuana. 98% of the student drug violators within the Seattle Public Schools from September 2013 to May of 2014 involved marijuana. In 2014, youth under the age of 20 made up 45% of statewide poison center calls since legalization in 2012. These calls have increased to 80%. The adult consumption rates in the state of Washington, 43% of adults polled in Washington reported using marijuana within the last year. 24% used at least once a month, 17% used at least once a week, and 6% used daily. 15% of respondents used marijuana for medicinal purposes, 11% used at least once a month, 9% used at least once a week, and 5% used daily. In the impaired driving in the state of Washington, 44% of marijuana DUI cases for 2015, it was polled January through April, tested by the Washington State Patrol Toxicology Lab, were over the legal limit of 5 nanograms per milliliter of blood. That was the minimum that they put in Washington to be under the influence. 64% of marijuana DUIs reported by the Spokane Valley Police Department during 2014 involved youth. 61.9% of drivers do not believe marijuana makes a difference in their driving ability, according to the roadside survey conducted by the Washington State Traffic Safety Commission. Drivers with active THC in their blood involved in a fatal driving accident have increased 122.2% from 2010 to 2014, according to the Washington State Traffic Safety Commission. So in Washington, this is what we're seeing here. The legalization happened in 2012. Commercialization happened in approximately 2014. And the last reported numbers were in 2015. And this is what we're seeing here in the Washington State Patrol Township. So some of what that means here in California is that we expect to see more DUIs on the road here in the state of California. The average year-over-year fatalities is about 8% per year. So these are a couple of pictures that were released as part of the report that Washington did as part of their study amongst users that were on the road that were involved in traffic fatalities here. There were 2 pictures that they did release as part of that study. And so one was involving an individual who was on a bike. He was a bicyclist who was actually thrown about 20 feet and died on impact of that. The other photo on the right is actually of a traffic fatality that involved 2 minors that actually did not survive. The driver of the car did, but the 2 minors did not. So I'm going to go ahead and open it back up for questions. So if you have questions, you're going to be able to go ahead and type those into the right-hand side, and I'm more than happy to answer those. Hi, Julie. Yes, it's actually broken down by state. So it was covering Colorado, Washington, and Oregon. So, Eddie, I don't know. That information would be in the reports that were released, and they were those are all cited. I think if you do I think I found them doing a Google search by typing in 2015 in the state and then the marijuana survey report is how I found them. Claudia, you had a question about California law says regarding possession or use of liquid edibles, a type of THC. It does not actually state the types of them. All of them are legalized. There was not a limit that was put in. They're waiting. There's actually going to be kind of like a sit down and everybody's going to have some input on that, but they're still kind of figuring things out. All I know is that at the current time that they did legalize recreational use of marijuana for those over the age of 21. So Alicia, the next question from Alicia, do we have any stats for California as of yet, and what are some of the links for study if we do? So that information is coming up as of this current time. There hasn't been any stats for California yet because it is so new. That information tends to come out anywhere from 2 to 5 years after legalization is how they're gauging that. So I'll go over that in a little bit. Diana, it depends on the concentration of the THC in the marijuana for how much it's going to be 5 nanograms. That's actually only in Washington. California did not actually set a limit of what is considered to be under the influence. Jason, next question's from Jason. So even though the percentages rose significantly, the total numbers are relatively low compared to the number of users in the states. That's based on information from users who self-reported. So that's not necessarily everybody that was surveyed. You'd have to read the entire report to find out how many total people were surveyed, considering California is more densely populated than the other 3 states that have had legalization on the books for a while. That could be more significant considering how many cars are on the roadway here in California. So the next question's for Alex. Poison control calls, what were the reasons for call-in? A lot of that is for I read an article that was given by the governor of Colorado. I didn't put it in. It was done through the LA Times. He actually opposed legalization in Colorado and it was passed. And he stated that we should pay more attention to the edibles because edibles were getting marketed to minors and they don't know the difference between infused marijuana products and non-infused. So a lot of those poison controls were because of minors who were under the influence and they were going to the emergency room and being treated for potential overdoses because they were ingesting large amounts of marijuana in those products, considering some of them are almost 73% infused toxicity for THC. It's quite a bit for somebody under the age of 16, 17, some as young as 8th graders, which is like 11 or 12, sometimes 13, depending on the age range. So, next question is, how will peace officers measure begin under the influence? Being under the influence. A lot of that is being talked about at the current time under SHSP. They are discussing what they can do to help train officers on our roads to be more aware of those who may not necessarily be under the influence of alcohol. A lot of police officers, they can smell that, but they don't always smell when somebody is under the influence of marijuana. So it could potentially be a little bit harder to detect in everybody. I apologize. Somebody ducked in here. I keep getting told of. I'm not used to doing the webinars. I'm used to doing the Thursdays at 3. So, Aretha, I hope that answered your question. The next question is from James. Has the government made any financial provisions to support potential increase in addiction and helping those families with addicted family members, or is this just another way to add dollars to the government coffers? So actually, James, I'm going to get into the funding breakdown that's going into the California Marijuana Tax Fund. I'm going to get into that in one of the next couple of sections here. The next question is from Tanya. What are your feelings about revenue being acquired through violations they're creating by legalization? We're not sure where the fines are actually going. We know where the tax dollars are, but I don't know where the fines are going. That has been something that that they're pushing forward a little bit farther down the road, I believe. The next question is from John Bakanovich. Is the 1 ounce possession rule for while out in public? It is for possession, period. So if you have more than an ounce, as far as I know, it states 1 ounce is the maximum. The rest is all felony. Next one, the next question from Alex Torres, have there been any deaths reported linked to marijuana overdose? At this current time, I'm not sure that there have been any. I haven't done any research into that information. So the next question is from Alfonso Gutierrez. Now that marijuana is legal, how or what is going to happen with the drug-free zone laws? It's still illegal to possess within 1,000 feet of a school, daycare, public places, things like that. Local governments have the right to restrict those ordinances. So, Lydia, okay, hold on. Jason, we are going to get into that section. Are we going to get into the making pot pay section soon? Yes, we actually are. I'm going to do a funding breakdown in one of the next sections. Lydia Toloy, you mentioned that they can smoke in any public place. Will it be similar to smoking a cigarette? What about the non-smokers? Actually, no, it's not legal to smoke in a public place at this current time. They are going to be making, they put into the proposition that they were going to have designated sections for individuals that wanted to partake of smoking or vaping marijuana. The next question is for Claudia Murillo. Just a follow-up question to the 1 ounce in public. Does that mean a person cannot have more than 1 ounce at home, for instance? I don't know the specifics on how much one plant will produce. And I think it depends on the type of plant that is being grown, because you can only have 3 flowering at one time. So if you have 3 that are flowering, you have 3 that are not flowering, and you can have a max of 6. You can have a max of 6 of them. Okay, and Sherry's chiming in there on the marijuana possessing deaths. And there were a lot of DUI fatalities, but none under marijuana overdosing. I'm guessing that's going to be overdosing. Under Aretha, as of right now, there is, you can possess, transport, or give away. There haven't been any licenses that have been issued for sale of marijuana at this current time. I know that you can still go and get medicinal marijuana from shops, and it used to be called, I think, a donation. You donated dollars to getting your medicine, was how they were getting around that information. But at this current time, there is not any legal licenses to sell. That will go into effect as of January 1st. And so moving on to the next section. So how is Proposition 64 different?
Stop.
So how does Proposition measure up to the other states? Under Prop 64, we did a screen chart all the way across to Colorado, Oregon, and Washington under administering agency and where that's going to be housed through each of the states. And then home grow permitted. Washington is odd man out. They did not allow individuals to grow at home, according to this information here. And then under DUI, they didn't set a minimum here in the state of California at this current time. They're going to be working that out, and as things become available for the testing of field sobriety tests and things like that, as that becomes available and that research comes into play, they will be starting to set that limit. But from what I understand, if you're impaired, you're impaired regardless of whether you're at the legal limit or not. You're still impaired to drive. So, and THC has a different effect on everyone. So, and that's the last one. Effect on medical marijuana. None specifically. Some effect from regulations on the cultivation here under Prop 64, but they're not changing Prop 215, so that's going to stay in effect. And then throughout the rest of the states, they changed a bunch of different things, or they allowed different things. Prop 64 was modeled very closely after the Colorado initiative. So the taxes. So this is where the money is coming from for all of the, when sale begins. So individuals will have to pay $9.25 per ounce cultivation tax and 15% retail tax. So that's what's going to be going into effect. And then there's a California marijuana tax fund that there's a breakdown on that was contained in the Prop 64 that I'll go over here in a little bit. Local government may prohibit cultivation and sale with a majority vote. They cannot prohibit home grows or use within the home, but they can publicly. And then I'm going to go over the revenue as well. So. Advertising prohibitions. This varied across the state. They can't do see-through packaging, they can't have cartoons, they can't do anything that would definitely like involve minors. So they don't want to advertise to minors. They can't do that. So that's one of the things that they did do as part of this, that made it attractive to children. THC limits, somebody asked about that. There was no limit on that. A license fee, and then this is going to be determined later to be set by a cost to administrator. Because Prop 64 was closely resembling Colorado, and then some was taken from Oregon and Washington, those fees may be somewhere in there, would probably be fairly close to an assumption on that. So I'm going to go ahead and open it back up for questions and do that. So let me see. So I'm flying as I'm going. So if you have any questions, you can go ahead and type those into the box to the right. And Jason, that is the article that Sherry referenced up above. Per that information, Sherry did reference that up above. So if you have any questions, that is open for individuals. If you'd like to ask questions, you can go ahead and type those questions in there to the right. So, and the next section will be on the revenue collected from that. So I know that there's going to be a lot of questions on that. And there is a huge breakdown on that information. So you'll be seeing a lot of that. So if you have questions about the revenue, that is actually the next section on where that money is going to go, and amongst treatment and research and all of that. So. Okay, so Alex, you had a question about, is it legal to advertise marijuana in media forms? It is, but they cannot broadcast or advertise during the times that children would be seeing that. They can't advertise in areas where children could potentially be advertised to. They also can't involve things like cartoons or anything of that nature that would attract children to that. That is one of the prohibitions that was put in under that. It says advertising prohibitions on Prop 64, no advertising, packaging, labeling, or product design attractive to children. So they can't do see-through, it can't be similar to a Snickers candy bar. It cannot advertise to children or be attractive to them in any way. Can't be a favorite cartoon character. I don't even know what some of them are anymore, but like can't be cereal like Captain Crunch or anything like that. They can't advertise to children. So Denise, you asked what tools will be used to measure marijuana intox level. Will it be available on site? Actually, at this current time, there's not really anything other than a blood test at this current time to measure the amount of marijuana in somebody's system at this current time. They are trying to work on a saliva test where they do in mouth, but it's currently undergoing FDA testing. As far as I know, that information can be Googled for. We did see some of that, and there was some of that that came up in the traffic safety conference call. The next question is from Nola. Since legalization, have we seen an uptake in counselors losing their credentials because of marijuana usage? I'm not directly involved in ethics, so I couldn't tell you at this current time if we're seeing any counselors that are losing their credentials because of marijuana usage. So I'm not directly involved in that. I would hope that we don't see any counselors lose their credentials and that they abstain from this. So the next question is from Ellen. Is there any budget increase for law enforcement to monitor how many flowering plants a home grower has and if they're outside distance from schools, etc.? I'm actually going to go over that information. It's one of the last sections. So that'll be going over that. But there is funding for CHP, but not necessarily for the monitoring or the law side to make sure that people are only growing 6 plants in their home and things like that of that nature. Next question, Alfonso Gutierrez, is growing allowed around a recovery home? I hope not, but I'm not 100% sure. Technically a recovery home or recovery residence, which is a sober living environment, each individual there has an agreement that they are there to live in a sober environment. So, and then if they are a registered home with CCAP, that will be something that I would say no, they probably are not allowed to grow that on the property or around. Mark, there is no DUI standard for marijuana intoxication. At this current time, no, there is not a minimum under Prop 64 for the state of California. What does the reference to the current DUI statute mean in terms of enforcement? It's kind of hard to say. Impaired is impaired. So it was explained to me that the legal limit for alcohol is 0.08. However, if you are not a drinker, or I mean, if you're not a drinker or you seldomly drink, one drink is enough to make you impaired, which means you can get a DUI. Even though you're not at the legal limit of 0.08, you can still be found guilty. You can still be charged and found guilty of a DUI because you are still under the influence and you are still impaired. Diana, is there any standard warning labels on products mandatory? Yes, they will have to notify consumers that there is THC contained in the products, that marijuana is present in those products, and then they will also have to label any kind of THC threshold that's in it. And so I'm gonna move on to the next section. And let me see. Let's see. Okay. So
heard.
Okay, so next section is, like I said, it's about the funding and where those tax dollars and the breakdown is going to be on. So where is that money going? So all revenue that's collected by the state is going to go into what's known as California Marijuana Tax Fund. 60% of all of the tax fund after all previous payments have been made towards prevention of substance abuse treatment. So we're guessing the state has done kind of an analysis about this funding, and it's based on what happened in the other states. The state saw $1 billion in tax revenue the first several years. So they did this breakdown on the funding based on those numbers. So about 60% after all previous payments have been made towards prevention substance abuse treatment. So they're guessing right around 600 million is going to go towards AOD. So we do see here research, which a lot of you have asked questions about, how that's going to go and things like that. There's research, it's $10 million dispersed over 10 years, and there is a little bit more of a breakdown on that in a little bit, on where that's going to go. The California Department of Highway Patrol is getting $3 million per year over 10 years. And then the, okay, so Ellen, you had that question about implementation and enforcement. It's $20 million per year for 10 years. So that is going to go towards that enforcement of 6 plants in the home. Only 3 of them are flowering. 3 of them are not flowering at one time. People are only carrying up to 1 ounce for personal use. They can't be giving it away to minors. They can't, they can transport, use, things like that, so long as it's on an open container in a vehicle, a moving vehicle anyway, so car, boat, or airplane. So the expected tax and license revenue is $1 billion per year. Business and economic development is getting $10 million for the first 5 years and $50 million after this time for 5 years. So there is going to be money going back into those communities to help kind of offset the costs and kind of build and grow those communities. So implementation. The 2600C, the legislature may, by majority vote, enact laws to implement this division, provided such laws are consistent with the purposes and intent of the Control, Regulate, and Tax Adult Use of Marijuana Act. So for call to action, who's going to decide those details? So the ones that I'm not 100% on, they're not included in Prop 64. Those are kind of being pushed down the road. We're definitely looking at some of those options to get information in and start setting limits and getting that money towards AOD treatment for individuals. So the revenue sections that are not AOD related, such as the law enforcement, the CHP, business, economic, and growth development. So these are going to be covered here. 20% shall be deposited into the Environmental Restoration Protection Account. That's to help offset the cost of bringing the land back to what it was prior to illegal grow. So I know that they used to do, they used to go out and have to destroy marijuana crops, and that would damage the land. So that's going back into that. 20% shall be deposited into the state and local government law enforcement account. $10 million is going to a public university or universities in California annually, beginning with the fiscal year 2018 to 2019 until fiscal year 2028-2029, to research and evaluate the implementation and effect of the Control, Regulate, and Tax Adult Use of Marijuana Act. So this study is going to cover the impacts on public health, including health costs associated with marijuana use, as well as whether marijuana use is associated with an increase or decrease in the use of alcohol or other drugs, the impact of treatment for maladaptive marijuana use and the effectiveness of different treatment programs, public safety issues related to marijuana use, including the studying of the effectiveness of the packaging and labeling requirement and advertising and marketing restrictions contained in the Act, at preventing underage access to and use of marijuana and marijuana products, and studying the health-related effects amongst users of varying potency levels of marijuana and marijuana products. marijuana use rates, maladaptive use rates for adults and youth, and diagnosis rates of marijuana-related substance use disorders. Marijuana market prices, illicit market prices, tax structures and rates, including an evaluation of how to best tax marijuana based on potency and the structure and function of licensed marijuana businesses. Whether additional protections are needed to prevent unlawful monopolies or anti-competitive behavior from occurring in the non-medical marijuana industry, and if so, recommendations as to the most effective measures for preventing such behavior. The economic impacts in the private and public sectors, including but not necessarily limited to job creation, workplace safety, revenues, taxes generated for state and local budgets, and criminal justice impacts, including but not necessarily limited to impacts on law enforcement and public resources, short and long-term consequences of involvement in the criminal justice system, and state and local government agency administrative costs and revenue. Whether the regulatory agencies tasked with implementing and enforcing the Control, Regulate, and Tax Adult Use of Marijuana Act are doing so consistent with the purposes of the Act, and whether different agencies might do so effectively. Environmental issues related to marijuana production and the criminal prohibition of marijuana production. And this is all in this $10 million study that they're giving to the universities that they have to cover. So keep that in mind. I know the slides are going, but there's a lot of stuff that they have to cover in these studies. And like I said previously, those studies that were done by the other 3 states, they're fairly large booklets, and there's a lot of information covered in them. So the last slide on this, the geographic location, structure, and function of licensed marijuana businesses and demographic data, including race, ethnicity, and gender of license holders. The outcomes achieved by the changes in criminal penalties made under the Control, Regulate, and Tax Adult Use of Marijuana Act for marijuana-related offenses, and the outcomes of the juvenile justice system, in particular probation-based treatments, and the frequency of upcharging illegal possession of marijuana or marijuana products to a more serious offense. So as part of the DUI section, the sum of $3 million annually to the Department of California Highway Patrol beginning fiscal year 2018-2019 until fiscal year 2022 to 2023 to establish and adopt protocols to determine whether a driver is operating a vehicle while impaired, including impairment by the use of marijuana or marijuana products, and to establish and adopt protocols setting forth the best practices to assist law enforcement agencies. The sum of $10 million beginning fiscal year 2018-2019 and increasing $10 million each fiscal year thereafter until fiscal year 2022 and 2023, at which time the disbursement shall be $50 million to the Governor's Office of Business and Economic Development in consultation with the Labor and Workforce Development Agency. So, and to the Department of Social Services to administer a community reinvestments grants program to local health departments and at least 50% to qualified community-based nonprofit organizations to support job placement, mental health treatment, substance use disorder treatment, system navigation services, legal services to address barriers to reentry, and linkages to medical care for communities disproportionately affected by past federal and state drug policies. So under the pharma study, the sum of $2 million annually to the Universities of California San Diego Center for Medicinal Cannabis Research to further the objectives of the center, including the enhanced understanding of the efficacy and adverse effects of marijuana as a pharmacological agent. There's not really much information as to why this particular university was chosen to do this portion of the study, but that's the one that was put into the Prop 64 to do this portion of the study. So this is where a lot of you are affected here. Revenue sections on AOD treatment. 60% shall be deposited in the Youth Education, Prevention, Early Intervention, and Treatment account and dispersed by the controller to the Department of Healthcare Services for programs for youth that are designed to educate about and to prevent substance use disorders and to prevent harm from substance use. The Department of Healthcare Services shall enter into interagency agreements with the Department of Public Health and the Department of Education to implement and administer these programs. The program shall emphasize accurate education, effective prevention, early intervention, school retention, and timely treatment services for youth, their families, and caregivers. The programs may include, but are not limited to, the following components: prevention and early intervention services, including outreach, risk survey, and education to youth, families, caregivers, schools, primary care health providers, behavioral health, and substance use disorder service providers, community and faith-based organizations, foster care providers, juvenile and family courts, and others to recognize and reduce risk related to substance use and the early signs of problematic use and of substance use disorders. Grants to schools to develop and support student assistance programs or other similar programs designed to prevent and reduce substance use and improve school retention and performance by supporting students who are at risk of dropping out of school and promoting alternatives to suspension or expulsion that focus on school retention, remediation, and professional care. Schools with higher than average dropout rates should be prioritized for grants. Grants to programs for outreach, education, and treatment for homeless youth and out-of-school youth with substance use disorders. Access and linkage to care provided by county behavioral health programs for youth and their families and caregivers who have a substance use disorder or who are at risk for developing a substance use disorder. Youth-focused substance use disorder treatment programs that are culturally and gender competent, trauma-informed, evidence-based, and provide a continuum of care that includes screening and assessment, substance use disorder, as well as mental health, early intervention, active treatment, family involvement, case management, overdose prevention, prevention of communicable diseases related to substance use, relapse management for substance use and other co-occurring behavioral health disorders, vocational services, literacy services, parenting classes, family therapy and counseling services, medication-assisted treatments, psychiatric medication, and psychotherapy. When indicated, referrals must be made to other providers. To the extent permitted by law and where indicated, interventions shall utilize a two-generation approach to addressing substance use disorders with the capacity to treat youth and adults together. This would include supporting the development of family-based interventions that address substance use disorders and related problems within the context of families, including parents, foster parents, caregivers, and their children. Programs to assist individuals as well as families and friends of drug-using young people to reduce the stigma associated with substance use, including being diagnosed with a substance use disorder or seeking substance use disorder services. This includes peer-run outreach and education to reduce stigma, anti-stigma campaigns, and community recovery networks. Workforce training and wage structures that increase the hiring pool of behavioral health staff with substance use disorder prevention and treatment expertise, provide ongoing education and coaching that increases substance use treatment providers' core competencies and trains providers on promising and evidence-based practices, construction of community-based youth treatment facilities. The departments may contract with each county behavioral health program for the provision of services. Funds shall be allocated to counties based on demonstrated need, including the number of youth in the county, the prevalence of substance use disorders among adults, and confirmed through statistical data, validated assessments, or submitted reports prepared by the applicable county to demonstrate and validate need. The departments shall periodically evaluate the programs they are funding to determine the effectiveness of the programs. The departments may use up to 4% of the money allocated to the Youth Education, Prevention, Early Intervention, and Treatment account for administrative costs related to implementation, evaluation, and oversight of the programs. If the Department of Finance ever determines that funding pursuant to marijuana taxation exceeds demand for youth prevention and treatment services in the state, the department shall provide a plan to the Department of Finance to provide treatment services to adults as well as youth using these funds. The department shall solicit input from volunteer health organizations, physicians who treat addiction, treatment researchers, family therapy and counseling providers, and professional education associations with relevant expertise as to the administration of any grants made pursuant to this paragraph. So I'm going to open this back up for questions right now. So you can go ahead and start typing in to the question section right there to the right. And so any questions that you have, you should be able to go ahead and type those in. More than happy to answer those questions for you. The next section we're going to discuss CCARA, and I'm going to invite Sherry Daly to come in and go over that information with all of you. Okay, so I do apologize. Sherry Daly is in here, and she's actually going to be answering these below, starting with Karen Nageli's comment, question about what's the process for accessing the funding. She's a lot more versed in this proposition than I am, so I'm going to let her take over. So,
hello, good afternoon, everyone. I'm Sherry Daly. I'm the Governmental Affairs Director for CCAP. So accessing the funding, there are several routes and several types of funding. So the funding that will go to actual direct care for youth treatment will be distributed to the counties through our normal distribution systems. There will also be a set of grants that will be put out, and those will run through a regular granting process. So we will, of course, alert you when those become available and would encourage you to participate. 10 million goes to mental health. Okay, so the question is posed that 10 million goes to health starting in 2018, and how is this trickle down process going to happen with services? Well, what is interesting about the initiative is that a lot of the details are not in it. So those have to be decided by the legislature and through a process of negotiation at the state capitol. Happy to report that CCAP is there to represent you and working very hard to make sure that those dollars are spent effectively. We are attending several meetings with coalition partners to gather support so that we all move in the same direction and advocate to spend those funds in the best way possible. Can a person legally smoke marijuana? As of today, yes. The smoking provision is in effect. However, the provision for sales, retail, and otherwise, local governments are given an opportunity to have a 45-day moratorium. Basically, whatever they had passed before the initiative passed, they can keep in place for 45 days. So a lot of cities have done that. So you'll have to check with your local jurisdiction as far as sale, transport, regulation within jurisdiction. Actually, someone asked if it's DHCS or the county behavioral that will be doing the granting. That's even kind of fuzzy. The Department of Healthcare Services is the primary distributor of the funding and is considered to be in the lead role as far as the agency, but that's not even clear in the initiative. So some cleanup will have to be done that. Can you hear me now? Why are they saying you can't hear me?
Scroll up here.
I can hear you.
Oh, I guess others can hear me. Can everyone else hear me? Your sound went off. Okay, I check your local device because others are hearing me. If you cannot hear me, maybe you're on mute, maybe your Wi-Fi is not working. Okay, so someone asked how much of the 60 million is actually allocated to counties to fund treatment. Okay, so it's not 60 million, it's 600 million. So we're looking at upwards of a $600 million figure, and the way that the initiative is constructed is it lists, I believe there are 8 pages of funding provisions. However, none of them are put into categories. So in other words, there's not, you have to spend 20% on prevention, you have to spend 50% on youth treatment, you have to spend 10% on physical plant capacity expansion. So that's good and bad. Good in that the drafters didn't have a whole lot of information or knowledge about what we do. So it's good that they didn't draft like they did in some areas where only education for high schoolers could be done. They left it pretty wide open and a very large laundry list with no percentages. So we're pleased that that will be something that we work out with the legislature and with the department. What is the proper way to report a person who has more than 6 plants? That's a local government issue, and that would be up to local law enforcement. And there is money in the initiative for local law enforcement. However, the local law enforcement is also allowed to tax an additional tax if they allow it to be grown or retail establishments in their area to pay for enforcement as well. So those who choose, those cities who choose to have just retail sales will also have a retail sales tax to pay for what that might bring. Okay, if a client is smoking in a car, yes, smoking in a car is illegal. It doesn't matter. Someone asked if there are direct funding from the State Department. Some of the funding will be in the form of grants, and those are particularly for the study issues. Some perhaps for workforce development and for community development. Someone was asking, had we learned what to do with these huge marijuana dollars from other states? Actually, we did learn. CCAP was out in front of the issue of funding. We saw that the 3 major marijuana initiatives that made recreational marijuana possible in 3 other states had very little funding for treatment. We entered the policy discussion very early and pushed very hard for as much of the revenue to go to treatment as possible because we were aware of what consequences recreational marijuana would bring to the state. So we are a national model in some ways in that we got 60% of that tax revenue to go to treatment. Okay, someone asked how the priorities are going to be set for the 600 million, and I'm going to go that into a slide here in just a moment to talk a little bit about what we're doing as far as trying to encourage how that money is spent. Couple more quick questions before we go on though, and we are going to go just a few minutes over because we started 10 minutes late, and some are applying for CEs for this, so we do need to go to that hour-and-a-half limit. So good question about how will counties record what what the need for youth treatment is in their county. We're hoping and looking into using a method that was used under Prop 63, in which they did a needs analysis for mental health patients. It was a pretty extensive process, so the Department of Healthcare Services has been through this on a prior occasion, so they do have the methodology to determine how that county allocation will be distributed. There was also a lot of needs assessment that went into the ODS waiver, so they do have some numbers based on that as well. I don't know if someone asked a question about if it's in an apartment building, does a landlord need to put it into writing that they forbid growing in their building? And I don't know the answer to that specific question, and it's probably too early in the game to actually get an actual answer to that question. Someone asked an interesting question about what about medical marijuana use by a counselor. Even under medical marijuana use, employers are allowed to govern whether their employees can use it or not. So that has not changed under the recreational program. All right, I'm going to go to the PowerPoint slides to tell you. Okay, so CCAP was very involved in making sure that we, if this passed, and we did not take a position, we did not support this initiative, but if it passed, that we would get maximum amount of that money coming into the state to provide some relief for what we felt would follow with recreational marijuana. So what we've been working on the last 6 months is called the California Comprehensive Addiction Recovery Act, or CCARA. They had a CARA, Comprehensive Addiction Recovery Act at the federal level. So we put together a California version of that, which has 4 pillars and has many ideas and strategies for using some of this marijuana proceeds. It also relies on other funding sources, so it's not completely dependent on marijuana funding, but where it does say that, for instance, workforce development, we can use that for seed money for licensure, for programs of educations, for loan paybacks, those sorts of things, because that's specifically in the initiative. Other things are less apparent or could be seen as vague, and we are pushing for funding from some of the revenue taxation, but also from other sources as well. So I'm going to run through those slides real quick so I can get you out in time.
Okay, so you have to cover that one, and then you have to do, pop that up right there, and then you go right here and click that button.
That?
And application window,
Okay.
and select that one.
Sorry, I'm learning a new skill.
There you go. So as long as you stay here, it'll show them.
Okay, so
This
right here.
Uh-huh.
Okay, so we are advocating for you with our California Comprehensive Addiction Recovery Act, whose goal is to provide on-demand treatment, to be the first state in the country that focuses on addiction as a public health crisis and provides treatment on demand. Now, what does that mean? How are we going to do that? To eradicate waiting lists, guarantee access to treatment, that's the mission. The plan is to be accomplished through a set of legislative bills to address 4 areas that are the cornerstones of a treatment on demand system. And I'll go over those 4 areas for you real quickly. And by the way, we will be doing a whole webinar on the CCARA and letting you know how you can get involved and how you can help us, and what it looks like, how to get updates on it in the coming weeks. But just to let you know what the pillars are, we're calling them pillars. The first one is physical capacity expansion, and that's funding for new addiction treatment facilities, funding for dedicated hospital expansion for chemical dependency treatment beds, and particularly detoxification units, funding for alcohol and drug-free recovery residences, and inclusion for incentives. When a plan is done for a city, they often give incentives if you have daycares or you have senior housing, and we would like to see a bonus for if you have recovery residence or treatment included in that plan. Also, waiving of the license bed fee that we're paying right now. All of our facilities pay a per bed license fee, and we're asking for that to be removed for a time period until the physical capacity in California is at 150% of what it is today. Also included in the physical capacity expansion is an anti-discrimination protection to reinforce what's already on the state and federal laws regarding local zoning that we're having so much trouble with. Parameters for voluntary certification of recovery residences that will be tied to how recovery residences receive payment and referrals. Mandatory certification of all outpatient treatment centers so that everyone follows the same rules. Some technical assistance to local governments who fall into the trap of trying to create onerous regulation of treatment or recovery residences in their communities, give them some help with what they can and can't do in those areas, and to do a statewide stigma reduction education campaign so that it's easier to cite facilities, people feel more comfortable talking about recovery going into treatment. The second pillar is the workforce expansion pillar. And of course, we need more workforce. That's our number one complaint when we visit programs, is there aren't enough people doing this work. So we have provisions in the CCARA to allow student loan repayment, the same as would be seen for marriage family therapists, for psychologists, for other mental health fields. Fee waivers for certification and testing fees. No cost tuition for our CAR Institute and other types of education. An information campaign to try and encourage young people as low as beginning with high school age to become interested in the profession of alcohol and drug treatment. And then the complaint we most often hear is that people don't stay in the workforce because the salaries are so low. So the CCAR would call for a 20% increase in reimbursement for direct treatment staff expenses based on what was paid in 2016 and phased in over 3 years. And establishing a career ladder that, of course, includes everything from peer support on up to licensure. The third pillar is the workforce professionalization pillar, and that involves, of course, the license, so that people will stay in this profession and not leave to go do other things. So we will be looking at supporting our existing certification system. Basically, this would be a reintroduction of our previous licensure bill, which made better linkages between the Department of Healthcare Services and the certifying organizations, and also created a private practice license. It would also ask that that the Department of Healthcare Services develop a set of parameters for peer professionals, including peer support specialists and recovery coaches, so that they would have an ability to be certified through one of the certifying organizations in California, and to require that interventionists be certified and that they have some rules to live by as well. The last pillar is payment reform, and this involves insurance. So there would be a prohibition of pay to patient for our out-of-network clients who finish recovery, go home, and then receive a large check. That would no longer be allowed. Prohibition against kickbacks. So there would be the same sort of rules that exist for mental health professionals and medical professionals, that you wouldn't be able to pay or receive a financial incentive for making a referral. And then a creation of an insurance task force to evaluate how things are going, particularly now that we have parity and the Affordable Care Act. So looking at things like network adequacy, are people getting enough treatment? Are there enough treatment providers within the networks? What are the barriers, if not? What is the level of knowledge of people who are making placement decisions and care decisions, step down, those types of issues? Status of coding and rate systems. We're still at an infancy stage in a lot of ways about how insurers are coding and paying for our services. And then some focus on some misuses of fail first policies and some mandatory step downs and multiple relapse patients. We're seeing a lot of reform needed in that area, but we felt that for the CCAR, we needed to put together this insurance task force to look at all of those issues and make some recommendations. So that's a lot to digest, and I really didn't mean to take up too much time in this presentation, but I did want to give you kind of a sneak peek on where we're headed in 2017, and to let you know that an entire webinar is forthcoming to talk in more depth about these issues. So I'm not sure how to get rid of my screen. I guess I just close it down. All right.
So if you turn that off,
And
I
then
can see
I
you
am
again.
back. Look, I learned a new skill today. So with that, I'm going to open it up for questions. So if you have any questions, feel free, and I'll start looking through here. I think we had some. So I'm not sure, Jenny, how they will be getting their CEUs. I assume that the list of people who participated will be reviewed and they will be sent out, but I'm not sure.
They're gonna get a Survey Monkey
Yeah,
Oh, you get a
And-
Survey Monkey
and an email.
yeah.
and an email.
From
They
Lisa
have to
Santel.
answer the questions.
So just like in our regular sit-down CEs, where you are required to do a post-test and answer questions, you will receive an invitation to participate in a Survey Monkey, and that will be your post-question part of the CEUs, and you need to complete that so that we can send you confirmation that you've received your CEs.
And the evaluation form.
And there's an evaluation form. And if you'd fill that out, it would help us. This is only our second webinar that CCAP has ever done, so we're looking to improve. So let us know what you liked and didn't like. BBS. Okay, so the BBS and the APA have their own. Someone asked a question about the BBS and the American Psychological Association's Code of Ethics, and I'm not familiar with what their policies are regarding marijuana. I can just let you know that at this point, our Code of Ethics has not changed, and that Code of Ethics, both for professionals and also under our sober living registrations, do include those Schedule 1, which marijuana is still, even though it's legal now, it is still in the code section in California law that is described in that type of drug, and that is written through all of our codes of ethics. So at this point, regardless of what other organizations have or haven't done, it is a violation of our code of ethics. Okay, so what is CCAR? It is the California Comprehensive Addiction Recovery Act. Someone asked, when do we receive the CEUs for the last webinar? This is brand new for us, so I'm not sure at what point you're going to get those back. Maybe when we send out the email, we can give you some advice on that.
They have to reply to the
Lisa Santel.
Survey Monkey and the survey.
Okay.
The evaluation form.
So when you're done with the evaluation form and the questions, then you will be given a confirmation. The PowerPoint will be provided. We'll send out an email to everyone who was on the webinar today, and all of our webinars, we are starting to make a library, so you'll be able to access them at later points as well. I don't know if the BBS, someone asked if the BBS and APA codes of ethics are the same as ours. I do not know that, sorry. Okay, so someone asked, how does CCAR address the lack of reimbursement for services provided by certified counselors? In a couple of ways. First of all, CCAR includes a licensure bill, so that would allow certified counselors to become licensed and participate in that sort of reimbursement. Of course, licensure is not a guarantee of reimbursement at other reimbursed rates, but it certainly would help. The other way is the 20% raise and pay for direct staff. So if you're working at a licensed facility that is participating in the medical ODS waiver, then the CCAR asks that those statistics on how much is being paid for direct counseling services be increased by 20%, phased in. So that should help as well. I don't know about how the CEUs work, so I apologize again. Thanks for the compliments about this being a great webinar. And I'm not sure how to print a webinar. So the CCAR, if that's someone asked if they could have this information to print. The CCAR is being drafted at Legislative Council right now, and then we will post the actual pieces of it on the website so you can download it, and we will post links to where you can track it online. And of course, we want your support at that time. What is my assessment of the future of credentialed counselors given the continuing integration of services? I think it's very positive. I think now that there's money to pay for addiction treatment through the Affordable Care Act and parity, and now through the Prop 64 funding, that my impression from our meetings around Sacramento is that they are looking to us for the expertise that we bring to the table, and that the future is very bright for a career in addiction counseling. So people in private practice, how would you get funded? At this point, the funds from Prop 64, sorry, will only be distributed through counties. So if you are in private practice, you would have to have a county contract to be included in that sort of revenue stream. I suggest anybody who is excited about youth treatment, that is where the money is going first. There's a trap door basically in the initiative that once the need for youth treatment is determined to be met, that funding can be spent for adults as well. There is also there are also provisions in the initiative that say you can treat multi-generational and families and loved ones of young people. We are also pushing very strongly for a definition of the age that would be considered youth to include transition-aged youth as well. So meaning that as long as you're still on your parents' insurance up to your 26th birthday, you would be included as youth for purposes of receiving that funding. We're also advocating that since you can't determine on any given day how many transition-aged youth you would have in a program, that some sort of percentage, perhaps 51% of your beds are allocated to youth or transition youth. Of course, not in the same facility, but either type, as long as you met the 51% that funding for physical capacity expansion, those types of things could be made available. So we're trying to keep the door as wide as possible so that the revenue can go to those who need it. We're also looking at trying to put some caps on how much is spent on Just Say No campaigns and advertising, that type of thing that has been shown to have little value in other states and with other substances. So lots of work ahead in 2017. I'm glad to be working for the organization and doing this for you all on a regular basis. It's very satisfying to be there when all of this is happening, and it truly is historic. At this point, I don't have any more questions. The PowerPoint, yes, we will send that as an attachment to the SurveyMonkey invitation, because I know for some people on some screens it was very clear and readable. On my screen it was a bit fuzzy, so I'm not sure if that's my equipment or if it's the function of the webinar, but I looked at it on several monitors here in the office, and for some people it was very clear, and on mine it was not. So I guess it's new technology for everyone, and I do have a really new laptop, so I'm not sure why mine came across fuzzy, but we will attach the PowerPoint and we will attach the SurveyMonkey, and we will attach a link to this webinar if you want to go back and review it or share it with your colleagues. I'm going to let Jenny close out, and thank you all for coming.
Hello, everybody. I'm glad that you were able to join us today. This is actually my inaugural webinar on something that I actually got to learn a lot about, still fairly fuzzy on details. I hope you enjoyed. We will be announcing more webinars in the future, and I hope that you will come back for those as well. For those of you who are asking questions about those CEUs, you will need to complete the SurveyMonkey along with the evaluation form prior to being able to get your certificate for your CEUs. You should get 1.5 CEUs for this presentation. So if you do have any questions, you can always email me. My email is my first name, JENNIE@ccap.us. I'm more than happy to answer any questions, or if you need this webinar emailed out separately from that for whatever reason you can't open it, or you having an issue locating that email as far as that goes. But that information will come from Lisa Santana. I believe that she will be sending that information out. So again, thank you all for coming, and we hope to see you next time.